Question 1. In the context of MRI imaging, the signal strength and image quality are often influenced by the signal-to-noise ratio (SNR). What is the most effective way to improve the SNR without increasing the scan time? A. Decrease the number of acquisitions. B. Increase the slice thickness. C. Use a lower flip angle. D. Decrease the bandwidth. Answer. Correct answer. B. Increase the slice thickness. Explanation. Increasing the slice thickness increases the number of spins contributing to the signal, effectively improving the SR. A thicker slice allows more protons to contribute to the overall signal, which can enhance the clarity of the image without needing additional scan time. Conversely, increasing the number of acquisitions A or using a low flip angle C could reduce scan efficiency, reducing bandwidth. D can increase SNR but may lead to more artifacts, especially chemical shift or susceptibility artifacts, which are undesirable in clinical settings. Question 2. Considering the fundamentals of MRI physics, how does the use of gradient coils assist in achieving spatial encoding during imaging? A. By creating a uniform magnetic field that increases SNR. B. By generating varying magnetic field strengths that localize the tissue being imaged. C. By suppressing background noise through selective frequency filtering. D. By enhancing the relaxation times of protons to allow better signal collection. Answer. Correct answer. B. By generating varying magnetic field strengths that localize the tissue being imaged. Explanation. Gradient coils are crucial for spatial encoding as they create variations in the magnetic field along different axes X, Y, and Z. This spatial gradient allows for the localization of signal in a particular area, which helps differentiate tissue types and their locations in the body. This technique is essential for high-quality, detailed images. The other options either describe the wrong functionality of gradients or do not directly relate to spatial encoding. Question 3. When faced with a clinical MRI scan, Mr. Anderson, an experienced MRI technologist, notices a motion artifact in an image due to patient movement. What is the best method to prevent this artifact from affecting future scans? A. Reduce the slice thickness to minimize the impact of motion. B. Use a higher flip angle to enhance the signal. C. Implement a patient immobilization technique and reduce scan time. D. Increase the repetition time (TR) to allow for better signal recovery. Answer. Correct answer. C. Implement a patient immobilization technique and reduce scan time. Explanation. Motion artifacts are typically caused by patient movement during the scan. The best approach is to implement techniques that minimize patient movement, such as using immobilization devices and reducing scan time to limit the duration of potential motion. While reducing slice thickness, it might improve spatial resolution. It does not directly address motion. Increasing the flip angle B or repetition time (TR)D may not help reduce motion artifacts and could potentially increase scan time, worsening the issue. Question 4. Under the assumption that a clinical team is using a fast spin echo FSE sequence to image the brain, which parameter adjustment would most significantly impact the speed of the scan without compromising diagnostic image quality? A. Decreasing the echo time T. B. Reducing the number of refocusing pulses. C. Increasing the matrix size. D. Reducing the number of slices. Answer. Correct answer. B. Reducing the number of refocusing pulses. Explanation. Fast spin echo FAE sequences use multiple refocusing pulses to speed up image acquisition. Reducing the number of refocusing pulses directly reduces scan time, and the impact on image quality is minimal if other parameters are properly adjusted. Decreasing TA might reduce the weighted contrast but does not necessarily speed up the scan. Increasing the matrix C or reducing slices D would compromise image resolution or coverage, which is undesirable in a clinical setting. Question 5. Taking into account the clinical indications for diffusion-weighted imaging to Y, in which scenario would Y provide the most significant diagnostic value? A. To visualize bone marrow edema. B. To assess the integrity of the blood-brain barrier in a stroke. C. To evaluate the cardiovascular system and blood flow. D. To image soft tissue tumors in the pelvis. Answer. Correct answer. B. To assess the integrity of the blood-brain barrier in a stroke. Explanation. Diffusion-weighted imaging (DWI) is highly sensitive to water molecule movement and is used primarily to detect acute ischemic strokes by identifying areas of restricted diffusion. This makes DWI particularly useful in evaluating the blood-brain barrier's integrity during a stroke. DWI is not typically used for visualizing bone marrow edema. Evaluating blood flow (C) or soft tissue tumors (D), as those conditions would benefit more from other MRI techniques such as perfusion imaging or contrast-enhanced imaging. Question 6. Demonstrated by research, the flip angle is a crucial MRI parameter. What would be the consequence of using too high a flip angle in an imaging sequence? A. Increased signal-to-noise ratio SNR. B. Higher signal intensity leading to better image contrast. C. Increased energy deposition, potentially leading to patient safety concerns. D. Reduced resolution due to inadequate data acquisition. Answer. Correct answer. C. Increased energy deposition, potentially leading to patient safety concerns. Explanation. A high flip angle can lead to increased energy deposition in the body, known as specific absorption rate (SAR). This can cause heating of tissues and raise safety concerns for the patient, especially in sensitive areas like the eyes or brain. While a higher flip angle might improve signal intensity or contrast, it can compromise patient safety. To excessive RF energy deposition, increased NRA would typically occur with more efficient imaging parameters, but a high flip angle is not the most effective method to achieve this. Resolution issues D are more commonly tied to matrix size or slice thickness. Question 7. Mr. Turner, an MRI technologist, is tasked with imaging a patient with an implanted pacemaker. Which of the following safety protocols is essential for ensuring patient safety during the MRI exam? A. Inform the patient that MRI is safe for all types of pacemakers. B. Use a low magnetic field strength to avoid interference. C. Screen the patient for any contraindications and consult with a cardiologist. D. Perform the MRI only in the 1.5 Tesla range for pacemaker patients. Answer. Correct answer. C. Screen the patient for any contraindications and consult with a cardiologist. Explanation. MRI safety protocols for patients with pacemakers involve screening for specific contraindications, such as the type of pacemaker and its compatibility with the MRI environment. Consulting with a cardiologist is critical to ensuring that the device MRI is safe, while low magnetic field strengths or specific Tesla range. VD may reduce risk. They do not fully eliminate the danger. Simply informing the patient that MRI is safe without further consultation is a significant safety oversight. Question 8. Correct answer. B. By relying on the intrinsic motion of blood flow to create contrast. Explanation. Magnetic resonance angiography (MRI) can visualize blood vessels without the need for contrast agents by utilizing the intrinsic motion of blood flow. This technique takes advantage of the difference in signal between static tissues and the moving blood, creating a contrast based on the flow dynamics. Proton density imaging. High-resolution spin echo sequences (C) do not focus specifically on blood flow, while adjusting TR-D could improve contrast but does not specifically highlight vessel flow in the same way. Answer. Correct answer. B. By relying on the intrinsic motion of blood flow to create contrast. Explanation. Magnetic resonance angiography (MRI) can visualize blood vessels without the need for contrast agents by utilizing the intrinsic motion of blood flow. This technique takes advantage of the difference in signal between static tissues and the moving blood, creating a contrast based on the flow dynamics. Proton density imaging. High-resolution spin echo sequences (C) do not focus specifically on blood flow, while adjusting TR-D could improve contrast but does not specifically highlight vessel flow in the same way. Question 9. Which of the following MRI artifacts is most likely to occur when imaging a patient with dental fillings? A. Susceptibility artifact. B. Chemical shift artifact. C. Motion artifact. D. Wraparound artifact. Answer. Correct answer. A. Susceptibility artifact. Explanation. Susceptibility artifacts. The Cohen, the magnetic field is distorted by the presence of metal as seen in dental fillings. These artifacts can distort the MRI image and cause areas of signal loss or distortion near the metal objects. Chemical shift. B typically involves fat-water misregistration. Motion artifact. C occurs due to patient movement and wraparound. D occurs when anatomy incorrectly positioned on the image due to inadequate field of view. Question 10. Which of the following is the primary function of using inversion recovery sequences in MRI? A. To enhance twaited imaging of fluid-filled structures. B. To suppress signal from fat tissue and improve contrast. C. To shorten the scan time by reducing the number of RF pulses. D. To improve the visualization of white matter in the brain. Answer. Correct answer. B. To suppress signal from fat tissue and improve contrast. Explanation. Inversion recovery sequences are primarily used to suppress unwanted signals from fat tissue, allowing for improved contrast between different tissue types. This is particularly helpful when imaging soft tissues, as it can provide better differentiation between structures. While they may improve twaited imaging of fluid A, their primary purpose is fat suppression. Scan time. C. And improving white matter visualization. D. Are not the main objectives of inversion recovery sequences. Question 11. Given the circumstances when performing a cardiac MRI to evaluate myocardial function, which parameter would have the most significant impact on improving the visualization of the heart's wall motion? A. Decreasing the matrix size to improve spatial resolution. B. Increasing the echo time. T. To highlight myocardial tissue. C. Adjusting the flip angle to maximize signal intensity from the heart. D. Implementing a short repetition time. TR for faster imaging sequences. Answer. Correct answer. D. Implementing a short repetition time. TR for faster imaging sequences. Explanation. A short helps to capture rapid changes in the myocardium, particularly in cardiac imaging, where fast temporal resolution is essential to assess wall motion. The other options either do not optimize for motion analysis or may compromise the resolution necessary to visualize the heart's functionality, such as decreasing matrix size or increasing TP. Question 12. Which of the following statements about the use of contrast media in MRI is correct? A. Gadolinium-based contrast agents increase the signal from fat tissues. B. Contrast agents are primarily used to improve the contrast between tissues with similar intrinsic signal intensities. C. The main purpose of contrast agents is to reduce scan time. D. Contrast agents are used to suppress unwanted signals from bones during imaging. Answer. Correct answer. B. Contrast agents are primarily used to improve the contrast between tissues with similar intrinsic signal intensities. Explanation. Contrast agents like gadolinium are designed to enhance the difference in signal intensity between tissues that have similar intrinsic properties, helping to better distinguish between them. They do not specifically reduce scan times. C. Suppress bone signals. D. Or increase fat tissue signals. A. Is to enhance tissue differentiation. Question 13. Demonstrated by recent studies which MRI technique is best suited for assessing the movement of water molecules within tissues, providing insight into cellular microstructure and tissue integrity. A. Diffusion-weighted imaging. Y. B. Perfusion imaging. C. Magnetic resonance spectroscopy. Misses. D. Inversion recovery sequences. Answer. Correct answer. A. Diffusion-weighted imaging. Y. Explanation. Diffusion-weighted imaging is used to assess the movement of water molecules within tissues, which provides valuable information about tissue integrity, microstructure, and abnormalities such as tumors or strokes. Perfusion imaging. B. Measures blood flow. Misses. C. Analyzes tissue metabolites, and inversion recovery sequences. D. Are used for tissue contrast enhancement. Do not focus on water diffusion. Question 14. In the modern context of MRI, what artifact would most likely result from patient motion during the scan, especially in the absence of sufficient patient stabilization techniques? A. Chemical shift artifact. B. Motion artifact. C. Wraparound artifact. D. Eddy current artifact. Answer. Correct answer. B. Motion artifact. Explanation. Motion artifacts are the result of patient movement during the scan, and these artifacts can distort the image and reduce diagnostic quality. Chemical shift A occurs due to differences in the resonant frequencies of fat and water. Wraparound C occurs when anatomy is folded due to inadequate FAV and eddy current. D. Artifacts are caused by the magnetic field changes due to gradients, are unrelated to patient movement. Question 15. To better understand the impact of resolution and MRI imaging, Mr. Davis wants to enhance the spatial resolution of an imaging sequence. Which of the following adjustments would be the most effective? A. Decreasing the slice thickness. B. Increasing the echo time T. C. Reducing the field of view FOV. D. Increasing the matrix size. Answer. Correct answer, D. Increasing the matrix size. Explanation. Increasing the matrix size improves spatial resolution by providing more data points per image, resulting in finer details. Decreasing slice thickness A can improve resolution but is not as directly impactful on spatial resolution as matrix size. Increasing T, B affects contrast and reducing FOV. C may reduce the area image but not necessarily improve resolution. Question 16. Upon closer examination of the clinical scenario, Mr. Lawson, an MRI technician, notices a chemical shift artifact affecting the abdominal scan of his patient. Which of the following is the best method to reduce this artifact? A. Decrease the bandwidth of the MRI sequence. B. Use a higher flip angle to improve signal intensity. C. Increase the field strength of the MRI scanner. D. Use fat saturation techniques to reduce fat signal interference. Answer. Correct answer, D. Use fat saturation techniques to reduce fat signal interference. Explanation. Chemical shift artifacts occur due to the difference in resonance frequencies between fat and water, and fat saturation techniques effectively suppress the fat signal to reduce these artifacts. Decreasing bandwidth A could increase SNR but might exacerbate other artifacts, and increasing field strength C or flip angle B could have minimal impact. Chemical shift. Question 17. When analyzing the impact of slice thickness on MRI imaging, which of the following is the most likely consequence of using a thicker slice? A. Increased spatial resolution. B. Reduced volume averaging. C. Enhanced signal-to-noise ratio SNR. D. Increased partial volume effect. Answer. Correct answer, D. Increased partial volume effect. Explanation. Using thicker slices increases the partial volume effect, where tissue types of different properties are averaged together, leading to a loss of detailed tissue differentiation. Thicker slices typically reduce spatial resolution and may enhance SNR. C, but do not mitigate volume averaging. B. Question 18. In light of recent developments in MRI imaging, how does parallel imaging contribute to improving scan efficiency? A. By reducing the number of required slice acquisitions. B. By shortening the time it takes to acquire data without sacrificing image quality. C. By increasing the matrix size to enhance spatial resolution. D. By improving the signal-to-noise ratio SNR in all images. Answer. Correct answer, B. By shortening the time it takes to acquire data without sacrificing image quality. Explanation. Parallel imaging reduces scan time by using multiple coils to acquire data simultaneously. This technique accelerates imaging without compromising image quality, making it especially useful for fast imaging sequences. It does not increase matrix size, C, or directly improve SNR. D. The method can reduce scan time. Question 19. The question remains whether the use of inversion recovery sequences is effective in suppressing specific tissue signals. Which tissue is most commonly suppressed using sequences in clinical practice? A. Bone. B. Fat. C. Blood. D. Fluid-filled structures. Answer. Correct answer, B. Fat. Explanation. Inversion recovery sequences are commonly used to suppress fat signals, improving contrast in images by reducing the intensity of fat tissues. This is especially useful in imaging soft tissue structures or when distinguishing between similar tissues. It is not typically used to suppress bone. A. Blood. C. Or fluid. D. Question 20. From a practical standpoint, when using a gradient echo sequence, what is the primary advantage of using gradient reversals to create the image? A. Gradient reversals enhance tissue contrast by utilizing phase differences. B. Gradient reversals allow for shorter echo times, improving temporal resolution. C. Gradient reversals enable rapid imaging by reducing scan time. D. Gradient reversals create stronger signals from fat tissue for better contrast. Answer. Correct answer A. Gradient reversals enhance tissue contrast by utilizing phase differences. Explanation. Gradient echo sequences use gradient reversals to manipulate the phase of the signal, creating contrast between different tissue types based on their phase characteristics. While gradient reversals may slightly reduce scan time, C, their primary function is enhancing tissue contrast through phase changes, not by improving fat signal. D. Temporal resolution. B. Question 21. In response to Mr. Thompson is preparing for an MRI of the brain with a high degree of tissue contrast, which MRI sequence would be most appropriate to emphasize differences in the relaxation times of various tissues in the brain? A. Fast spin echo FAE. B. Inversion recovery C. Gradient echo GRI. D. Spin echo C. Answer. Correct answer D. Spin echo C. Explanation. The spin echo C sequence is commonly used to highlight differences in T-relaxation times of tissues, such as in brain imaging, where precise tissue differentiation is crucial. FSEA can speed up imaging but is not specifically designed for T-contrast. B is more focused on suppressing certain tissues like fat, and then GRI. C is more sensitive to magnetic field inhomogeneities and is better for imaging blood vessels rather than enhancing tissue contrast. Question 22. The growing trend in MRI technology involves the use of parallel imaging. How does this technique typically reduce scan time without compromising image quality? A. By using multiple receiver coils to simultaneously acquire data from different regions. B. By decreasing the field of view (FOV) to focus on smaller regions of interest. C. By increasing the repetition time (TR) to allow for more detailed imaging. D. By lowering the matrix size to reduce data acquisition time. Answer. Correct answer A. By using multiple receiver coils to simultaneously acquire data from different regions. Explanation. Parallel imaging uses multiple coils to simultaneously acquire data from different parts of the body, reducing the time needed for a complete scan. This allows for faster imaging without sacrificing image quality. Decreasing FOV B can make images smaller but doesn't inherently reduce scan time. Increasing TR would increase scan time, and lowering matrix size D would reduce image resolution. Question 23. While examining the MRI scan of a patient with a suspected brain tumor, Mr. Jackson notices a ring-like artifact around a metal implant. What artifact is most likely causing this distortion? A. Chemical shift artifact. B. Susceptibility artifact. C. Wraparound artifact. D. Motion artifact. Answer. Correct answer. B. Susceptibility artifact. Explanation. Susceptibility artifacts occur when there is a difference in the magnetic properties between tissues, often due to the presence of metal implants. The magnetic field distortion around the metal causes image distortion, which is particularly noticeable in certain sequences. Chemical shift A affects fat and water signals. Wraparound C happens when anatomy is folded due to insufficient FOV. Artifacts D are caused by patient movement. Question 24. What is the primary reason for using fat saturation techniques in MRI scan of the liver? A. To enhance the signal from blood vessels. B. To suppress the signal from fat and highlight other tissues. C. To improve the image contrast in the bone marrow. D. To reduce scan time by eliminating fat-related interference. Answer. Correct answer. B. To suppress the signal from fat and highlight other tissues. Explanation. Fat saturation techniques are used to suppress fat signals in order to improve the contrast and highlight other tissues, particularly useful in liver imaging. This helps to distinguish between liver lesions and surrounding fatty tissue. It does not specifically enhance blood vessel signals. A. Improve bone marrow contrast. C. Or reduce scan time. D. Question 25. In what way does increasing the field strength of an MRI scanner impact image quality and diagnostic capabilities? A. It primarily enhances the signal-to-noise ratio (SNR), improving image clarity. B. It leads to increased susceptibility artifacts in areas with metal implants. C. It decreases the resolution of images by introducing more noise. D. It reduces the need for contrast agents in most imaging scenarios. Answer. Correct answer A. Primarily enhances the signal-to-noise ratio (SNR), improving image clarity. Explanation. High field strength MRI scanners provide a better signal-to-noise ratio (SNR), which improves the clarity and quality of images, while increased field strength can potentially increase susceptibility artifacts. B. In metal regions, it does not inherently reduce resolution. C. Or eliminate the need for contrast agents. D. And improves the overall imaging process, making it easier to distinguish subtle differences in tissue. Question 26. Based on the information provided in recent studies, which artifact in MRI occurs due to undersampling of data and causes visual ringing in the image? A. Wraparound artifact. B. Truncation artifact. Gibbs artifact. C. Chemical shift artifact. D. Eddy current artifact. Answer. Correct answer. B. Truncation artifact. Gibbs artifact. Explanation. Truncation artifact, also known as Gibbs artifact, occurs when the sampling of data is insufficient, causing ringing or ripples to appear near the edges of structures in the image. Wraparound artifacts occur when anatomy is folded over into adjacent areas. Chemical shift, C, is due to fat and water signal misalignment, and eddy currents, D, result from magnetic field distortions caused by gradient switches. Question 27. The implications of applying an inversion recovery sequence in imaging are well documented. Which of the following tissues would most likely be suppressed by this sequence in brain imaging? A. Brain parenchyma. B. Cerebrospinal fluid (CSF). C. Fat tissue. D. Muscle tissue. Answer. Correct answer. C. Fat tissue. Explanation. Inversion recovery sequences are primarily used to suppress fat signals, which helps to enhance the visibility of other tissues in imaging, especially in the brain. It is not used to suppress brain parenchyma, CSF, B, or muscle D, as these tissues do not require suppression for better contrast in this context. Question 20. In terms of MRI safety, which of the following is most important when dealing with patients who have implanted medical devices? A. Ensuring that the patient's metal implant MRI compatible. B. Reducing the repetition time (TR) to minimize scan time. C. Increasing the matrix size to improve image resolution. D. Using longer echo times T to improve tissue contrast. Answer. Correct answer A. Ensuring that the patient's metal implant is MRI compatible. Explanation. The most important consideration when dealing with patients who have implants is ensuring that the implant is MRI compatible. Some implants can pose risks if they are not MRI safe, potentially leading to burns or dislodgement, while reducing TR. B. Or increasing matrix size. C. Improves scan efficiency. It does not specifically address safety concerns related to implants. T. D. Affects contrast but does not resolve implant safety issues. Question 29. Which of the following is a primary advantage of using diffusion-weighted imaging (DWI) for detecting early-stage ischemic stroke? A. DWI enhances the ability to differentiate between blood vessels and brain tissue. B. DWI allows for the visualization of white matter tracts. C. DWI detects changes in water molecule movement, highlighting areas of acute ischemia. D. DWI suppresses signals from surrounding normal brain tissue. Answer. Correct answer. C. DWI detects changes in water molecule movement, highlighting areas of acute ischemia. Explanation. Diffusion-weighted imaging DWI is highly sensitive to the movement of water molecules within tissues. In the case of ischemic stroke, DWI detects changes in water molecule diffusion, which helps to identify areas of acute ischemia. It does not specifically differentiate blood vessels from brain tissue. A. Visualize bladder tracts. B. Or suppress surrounding tissue. D. Question 30. Which of the following parameters would most likely impact the signal-to-noise ratio (NR) in an MRI scan? A. Reducing the echo time. T. B. Decreasing the slice thickness. C. Increasing the matrix size. D. Using a higher field strength scanner. Answer. Correct answer D. Using a higher field strength scanner. Explanation. A higher field strength scanner increases the SNR, improving image clarity and detail. Reducing TA can help with timing but does not directly improve SNR. Increasing slice thickness B may reduce the amount of tissue sampled and potentially lower SNR, and increasing matrix size C can reduce SNR by requiring more data to be processed.